Welcome to Medicare Basics in 10 minutes. I hope that you find this video helpful, informative, and makes Medicare simple. So let's talk about original Medicare. Original Medicare is divided into two parts. Part A is hospital. Think inpatient. You go into the hospital and spend the night, it's going to activate A. Part B, medical. Think outpatient. Doctor visits, diagnostic testing, even like chemotherapy on an outpatient basis, that's going to fall under Part B. So one of the things that's very important for you to remember is original Medicare does not cover everything. You're going to have out-of-pocket costs, prescriptions that you pick up at the pharmacy, that's Part D of Medicare, not A and B. Routine dental, vision, hearing, eyeglasses, contacts, not A and B. Long-term care, not A and B. And also foreign travel, very limited, but generally not going to be covered under A and B. So let's talk about Part A. For most people, Part A is premium free. As long as you have 40 quarters, or your spouse has 40 quarters of working and paying into the system, that's 10 years, you qualify for Part A, premium free Part A. So if you go into the hospital, you're gonna pay a $1,600 deductible this year. That's per benefit period, just means you can hit it more than one time a year. If you are in the hospital way longer than 60 days, you can have a per day cost. And note, there's no out-of-pocket limit, but we'll pick up that on the next slide. So Part B, there is a premium. It's $164.90 for this year. And that's for most people. If you're a higher income earner, let me know and I can send you the chart. You could pay more. Now, there is an annual deductible under Part B. It's $226, and then it's 80-20 coverage. 80% the government's going to pay, and you're going to pay 20% for most covered services. If you use a doctor that wants to charge more than what Medicare approves, they can do that and charge an excess charge. It's capped at 15%. With some more out-of-pocket costs you could be responsible for. And then finally, there's that same no out-of-pocket limit. So just think of Part A and Part B don't have an out-of-pocket max. So for like approved services and costs, if it was $5,000 or $500,000 under Part B, you're going to pay 20%. It just never stops. So that's a risk that we have to deal with. So how do we deal with those risks? Well, you're really going to pick between one of two options. Forget insurance companies right now. All the stuff that you get in the mail really fits into one of two buckets. So let's talk about the first bucket. Well, first we have what's called a Medigap plan, or also a Medicare supplement. Those are interchangeable. Really, you have A and B, you're still on original Medicare, and then you add, or you're going to buy a Medicare supplement plan. Medicare supplements are designed to come in and pay for those things that you'd have to pay for under A and B. Remember the 20% under B, the $1,600 deductible under A? A supplement's designed to come in and pay most or all of that for you. So if it doesn't fall under this A and B, then the supplement generally won't pay. So remember Part D, that's why there's a separate section on there that says you can add a Part D drug plan because it doesn't fall under A and B, so the supplement doesn't provide prescription medication coverage. Dental, vision, and hearing is going to be the same way. So I call this a buy-up option. You're going to pay an additional premium, but it's going to be very, very flexible and very, very comprehensive. But let's look at it a little bit deeper. This chart you're going to see everywhere, and it can be really, really confusing. You have all these letters at the top, more letters. Yeah, I understand. But let's break it down so it's more understandable so that you can understand what this chart is saying. On the left-hand side, you see the benefits. That is going to be the benefits we kind of just mentioned, a few of them. The Part A deductible, the co-insurance amount for Part B. It's the things that you'd have to pay for if you didn't have a supplement. Go over and look at all the percentages. Let's zone in on the Plan G. If you look down, you'll see 100% on almost everything. That just means that that's how much of the gap it's going to pay for you. So if you have the 20% under B, the G plan is going to pay 100% of that 20%. You just slide your eyes all the way down. You'll see there's really one completely blank gap. That's the Part B deductible. That's that $226. So Plan G is really, really comprehensive. You go anywhere Medicare is accepted, A and B all throughout the United States, it's going to give you almost 100% coverage for things that fall under Part A and Part B. Now, it's really important to know that if you're going on to Part B for the first time, you have what's called the Medicare Supplement Open Enrollment window. So for 6 months, beginning with when your Part B starts, you can get a Medicare supplement, no health questions, no underwriting. You can't be denied for any reason. That's really important. That window can close, and later on, you could be subject to underwriting. And if you have something the insurance company doesn't like, they can say, no, you cannot come on it. So that's the Medigap plan. I call that the buy-up. You're going to pay an additional premium for it. If you have any more questions on the Medigap plan, I can help you with it and give you even pricing as well. The other option, so that's one. So the other option, the second option that we're going to look at is Medicare Advantage Part C. So these are all-in-one bundled plans for the most part. Most Part C plans are going to give you your A and your B. They're going to bundle in your Part D, usually. And then they might give you additional things like dental, vision, hearing, Part B premium give back. There's different things that you can qualify for depending upon which plan it is. So you have to continue to pay your Part B, but I call these the pay as you go because many of these plans, depending on where you are, you could pay as little as $0 as a premium. So what are they? Essentially, they're bundled plans where you're under the umbrella of the insurance company and you're going to be subject to those summary of benefits. So while you might not have to pay much for the plan itself on a monthly basis, the more you access care, you're likely going to pay as you go. So you'll pay co-pays, co-insurance, things that they're used to paying maybe on your traditional insurance when you were working. That's generally how it works. You're going to have deductibles and co-insurance, co-pays, and things like that. So that's just really important to know because it's very different usually than a supplement plan, which you stay on original Medicare and the supplement follows. The Advantage plan, you're under the umbrella of that insurance company, and so you're subject to the terms and conditions of that plan. I'm going to mention Part D drug plans very briefly because they're very, very confusing and they're specific to your prescriptions. Even if you're in the same household, you're probably could have different prescription plans. There's two ways to get one, and you already saw it. One is through when you get a Medicare supplement, you can get a standalone Part D plan, or it can be bundled in your Medicare Advantage plan, that second option. There's phases that you go through when it comes to coverages under Part D plans. These are all regulated by the government. And I just like to put this here because they're very individualized, and where you are in that phase depends upon your prescriptions entirely. There's some new things coming out, new legislation, benefits phasing in. So I have other videos for that. So when do you enroll? When you're turning 65, you have a 7-month window, 3 months before your birthday month, and 3 months after. If you have your birthday is the first of the month, it actually starts a month earlier than that. If you're already drawing Social Security, you will generally be enrolled automatically. If you are not, then you need to go to Social Security's website and you can enroll in Medicare. You can roll into it as part of your Social Security benefit, or you can enroll for Medicare only. Be aware that there can be penalties if you don't enroll when you're supposed to. Special enrollments, working past 65 is a little bit beyond this video, but you do have some special enrollment periods if you come on to Medicare later. Please see my other videos or let me know and we can talk about your individual situation. The annual election period, October 15th to December 7th, that's when you can enroll in, change, or disenroll from a Part D standalone plan or a Medicare Advantage plan. Remember, that was number 2 on the chart. And if you don't enroll into Medicare when you're first eligible, there's the general enrollment period between January and the end of March. So be aware of that. If you have more specific questions that you would like or like me to address, just go ahead and go to my website. You can just click on and have a free little consultation. It doesn't cost you anything, little 15-minute call. And then here's all my contact information if you'd like to get a hold of me in other ways. I hope this has been helpful. Please shoot me an email if you found it helpful. If there's any other questions that you have, contact me and I'd be happy to help. All of my services are always free to you, and I hope you have a great day.